Hello everyone, welcome to my class today. Today we'll see a nursing care plan on a patient with myocardial infarction. So if you are the first time watching my video, please like, share, subscribe and click the notification button and stay tuned. So myocardial infarction patient will have terrible chest pain. So the first diagnosis is acute chest pain related to myocardial ischemia, secondary to coronary obstruction. So coronary arteries are supplying the myocardium. So when they are getting obstructed by atherosclerotic plaque formation, patient will have lack of oxygen supply to the myocardium, where the person will get the chest pain. So the objective is to relieve the pain, and the nursing interventions are: we have to monitor vital signs, check for the ECG, oxygen saturation, pain score. So when we know the baseline of the patient, then we can start with the intervention. So high Fowler's position is provided with supporting with cardiac table. This is to relieve discomfort and also help in breathing. And the precipitating factors means those factors which is inducing pain, the quality, whether it is burning sensation or any pricking like sensation, like that we have to ask, and intensity and severity of the pain we have to identify, so that we can see whether the patient is able to tolerate or not. And oxygen therapy in order to help in breathing, and also myocardial cells are not receiving oxygen, so we have to give excess oxygen therapy. And complete bed rest, because already oxygen lack is there, so we have to tell the patient to take bed rest and minimize the that is conserve the oxygen spent by the tissues. And injection morphine, because chest pain is very severe in these cases, so we have to give very potent analgesics like injection morphine. And thrombolytic therapy, thrombolysis means destroying the blood clot, so any streptokinase or urokinase according to the ECG values we have to start the drug. And also there are so many pre-medications we give before starting the drug, and also patient will be kept under observation when this drug is administered. And anticoagulants like clopidogrel and ecosprin to relieve the clot we have to administer. And nitrates like injection nitroglycerin, so this will help in vasodilation and also increase the blood supply to the myocardium. And psychological support and diversional therapy in the form of mild music and watching TV can be provided. These can help in divert the mind of the patient from pain. So in evaluation we have to see whether pain is relieved. Okay, and next is ineffective breathing pattern related to pulmonary edema, secondary to decreased myocardial contractility causing decreased cardiac output and backflow of fluid into the pulmonaries. Okay, so when there is no forward movement of blood because of myocardium is not effectively contracting, then the blood is backing flow and it can fill in the pulmonaries, so patient can go for pulmonary edema. So these are the assessment, and our objective to improve the breathing pattern and also help in respiration. Here also we have to monitor vital signs, ECG and oxygen saturation to identify the baseline data, and also see how much oxygenation is there for the patient. And Fowler's position like comfort devices like cardiac table, again this is to ease the breathing. And well ventilated environment is provided, so like there should be good cross ventilation so that patient will have enough air to breathe. And oxygen therapy with mask or NIPPV is non-invasive positive pressure ventilation, and mechanical ventilator will be given in order to aid in breathing. And nebulizer therapy, so this also will help in liquefying any secretions, because pulmonary edema there can be secretion, it can become thick, so in order to remove the excess secretions we give nebulizer therapy. Chest physio like breathing and coughing exercise, these all help in airway clearance and also help in breathing. And advise the patient to take complete bed rest for first few days. Okay, so when patient is having severe myocardial infection, until treatment is completed we have to take complete bed rest, so that there won't be enough wastage of oxygen by tissues. And diuretics like classics will be prescribed if patient is having pulmonary edema, we have to relieve the fluid, so diuretics is given. And anti-anginals like morphine, so it is for severe chest pain we have to give the morphine, and also morphine has the ability to trigger the medulla oblongata and also initiate breathing, so even in breathing pattern we have to administer morphine. And inotropic drugs like digoxin, so this will help in contraction of the myocardium, so that there won't be backflow of fluid and pulmonary edema can be decreased. And salt restricted diet, so again when patient is having edema we have to decrease the salt so that edema can be cleared and patient breathing will be normal. So after all this intervention, we have to evaluate whether the breathing has become normal. Okay, and next is ineffective cardiac tissue perfusion related to formation of atherosclerotic plaque in the coronary arteries, leading to decreased myocardial blood supply. Okay, so when the coronary arteries are obstructed, coronary arteries is not able to carry the blood supply, so myocardium will not receive enough blood supply and oxygen, that is so that there is cardiac problem in cardiac tissue perfusion. So our goal is to maintain effective myocardial tissue perfusion. So mostly only with surgical treatment we can provide perfusion to the myocardium. So when other pharmacological measures fail, then we have to give surgical treatment and help the patient, help the myocardium to receive the blood supply. So again here you have to see the vital signs and pulse oximetry for baseline monitoring, oxygen therapy via face mask or as needed we have to start, and IV fluid should be given in order to increase the blood flow, and beta adrenergic blockers like atenolol should be prescribed. So this also to decrease the oxygen demand for by the myocardium, and nitrates will be given, nitroglycerin, so it is a vasodilator so that it will dilate the blood vessel and improve the myocardial tissue perfusion, and advise the client for the need for surgical procedures. So according to the type of vessel and how many coronary arteries are, how many branches of coronary arteries are gone for disease, we have to advise the patient to go either for angiography or a bypass grafting. So this will create a channel for blood supply to the myocardium, and first we have to advise, and once the patient is ready for surgery, then we have to prepare the client for the surgical procedure and advise the client to avoid all strenuous activities because it can cause dyspnea and palpitation. So anytime in the first few days we have to tell them to avoid the strenuous activities. Again, salt restriction in order to prevent decrease the BP and also to prevent the pulmonary edema. Next, coming to anxiety. Okay, so when we say of surgical procedure and also heart attack itself will give more fear and anxiety to the patient. So anxiety related to chest pain, surgical intervention, and need for permanent lifestyle changes. So our goal is to relieve the anxiety and promote a sense of well-being. So you have to identify cause and level of anxiety. Psychological support will be provided by explaining what are the different treatment available, and positive reinforcement will be given, and also tell the patient surgical management is there, and also motivate the patient to undergo surgery, and also say what is the survival rate after surgery. So all those things you have to explain, and sedatives and anxiolytics will be given to relieve the anxiety. So diversional therapy in order to divert the mind of the patient, deep breathing, coughing exercises to promote sense of well-being, and they will relieve the anxiety, and introduce the client to any other person had MI and undergone surgical intervention and they are progressing well. So that patient you have to introduce, and we have to gain the confidence of the patient, and you have to provide reassurance that all treatment is carried out and patient will recover faster. And also we have, whenever we say about reassurance, we must say only the factual point. Okay, so what could not be possible, that we should not tell, and encourage verbalization of feelings and perception. So we have to encourage the person to come out with his feelings, so that we will know what is the stress, what is his anxiety. So from that we can give the psychological support, and also allow family members to stay with the client, because when patient is alone before surgery he may get anxious. So you can allow any family member preoperatively to stay with the person. And next diagnosis is activity intolerance related to decreased blood supply to the tissues secondary to myocardial ischemia, leading to decreased myocardial contractility. So next patient will have problems with activity because there is no enough blood supply to the tissues, because myocardium is not contracting properly. So goal is to patient has to maintain the normal activity. So here also vital signs, pulse oximetry should be monitored, complete bed rest will be given, and also environmental stimuli, and visitors will be restricted more after surgery in order to prevent infection, and also help and assist the patient in doing all the daily activities like personal care, ambulation, etc. And advise the client to avoid all strenuous activities. So especially during dyspnea palpitations, he has to avoid strenuous activities, and provide suctioning, chest physio, breathing exercises. This to help in early recovery and patient can maintain his activity. And also help the patient to turn in the bed and sit up slowly, and then gradually you can help in ambulating the person. Next is risk for infection related to the surgical intervention of the thoracic cavity, causing break in the continuity of the skin from surgical wound. Okay, so whenever surgery is there, there is a broken wound and the microorganism can easily enter. So you have to assess temperature, surgical site you have to assess for infection, and WBC count, urine analysis. We have to see if there is any infection in the blood and the urine. And surgical dressing site, we have to do dressing with aseptic technique. And IV fluids like vitamins, electrolytes should be administered properly, because only when there is adequate nutrition, patient immune system will function in order to fight against the infection. And strictly restrict visitors and outsiders to enter the surgical or the recovery room, because they can carry infection. And put on sterile hospital clothing for the patient, and also keep the client in the cardiac recovery, where there will be no access with the outside staff members or other persons of the ward, so that it is a strict isolated area to practice the infection protocols. And all the IV lines, so whatever catheters are there, all the care has to be given with an alcohol swab. We have to clean the catheters so that we can prevent infection through the catheter site. And all the hygienic practices we have to teach, and also universal precautions, so that the patient will follow at home. Okay, and finally, ineffective therapeutic regimen management related to lack of knowledge about the disease condition. It's management, lifestyle changes, and home care activities. Objective is to gain knowledge. So here you have to assess the client's language and ability to follow instructions, and we have to teach them in their own level of understanding. Educate the client on all the hygienic measures, so that it helps in prevent infection. And on nutritional therapy, so initially patient with any myocardial infarction, they will be on a clear liquid diet, and gradually they will be on liquid, soft solid, and semi-solid diet. So you have to tell when they can resume with the diets. Okay, and also educate about disease condition, causes, signs and symptoms, treatment modalities, complications, everything you have to treat and teach them, and tell them to follow, so that they will get knowledge about the disease condition, and whenever there is complications, they can come to the hospital. And also all the lifestyle changes like lead for lifelong medication, salt and cholesterol restricted diet, exercises, and like avoiding strenuous activities for first year of surgery, everything you have to inform, so that they will have a safe period at home. And advise the client to take all medications regularly, so for that they will get complete recovery and treatment. And deep breathing, coughing, and spirometry exercises has to teach them, and also tell them to keep the pad on the surgical site, or a towel on the surgical site, or a small pillow they can keep, and they have to support the surgical site while coughing. Okay, so all those you have to teach them after surgery. And also tell the patient to take lots of oral fluids. This will prevent dryness and dehydration. And teach the patient on all the cardiac rehabilitation, and also they advise them to attend all the cardiac rehabilitation classes, so that there will be complete recovery. Okay, advise the client to come for regular follow-up, and also during follow-up they have to monitor for ECG, echo, etc., so that we can identify whether the patient has cured. So these are the interventions we do, and we see whether client has gained knowledge. I hope you have understood my class. Please like, share, subscribe, and click the notification button, and stay tuned. Thank you.